Poster presentation on home-based cognitive interventions to improve self-feeding in older adults. The people presenting today are Sydney Carroll, Ryan Grimsley, Kaylee Jones, and Abby Cargill, and Haley Salyer. Hi, this is our poster presentation. Our study is to determine if cognitive-based interventions as a part of occupational therapy treatment will have an impact on self-feeding skills of individuals with dementia. We use a mixed methods survey that provided us with data that allowed us to establish a baseline of perceived self-feeding skills in the home healthcare setting. Our study included 28 participants from ages 65 to 90 with dementia who qualify for home health services. Our hypothesis is that cognitive behavioral therapy as a part of OT in the home health settings will improve independence and self-feeding outcomes for older adults with dementia. This led to our research question of, do cognitive interventions used as a part of OT in the home health care improve independence of self-feeding outcomes for older adults with dementia? The purpose of our After our review of the literature, our rationale for our study is that self-feeding and other activities of daily living are directly impacted by cognitive and physical impairments experienced by individuals with dementia. A gap in the literature that we found is that most of the research conducted up until 2003 has been about people with dementia and mealtime difficulties, and they have only been conducted in case studies. Additionally, the systematic reviews that we looked at were about mealtime difficulties for older adults with dementia that took place in long-term care settings. So our significance of the proposed research is that the goal is to gain more understanding on how OTs can impact the performance of ADLs by people with dementia through various intervention strategies. ADLs such as self-feeding are essential to living in a social world, and they enable basic survival and well-being, and it's the main focus of OT.
Our research design has two groups, an intervention group, which receives typical OT treatment with cognitive behavioral therapy focused on self-feeding strategies, and a control group, which utilizes typical OT treatment. The location is within home health care settings in Austin, Texas, and the time for the intervention includes 2 one-hour sessions a week for 3 months. The administration of the intervention will be by registered occupational therapists who are certified in cognitive behavioral therapy. The assessment used in the intervention is the Functional Independence Measure assessment, which will be administered at the beginning and the end of the study. The methodology of our study includes a mixed methods survey. Our survey did not include questions about demographics, but to better understand the participants, we would include questions such as marital status, ethnicity, education level, and age. Our survey also did not include a Likert scale, but the use of a Likert scale would allow the answer choices to be more sensitive and the results would be more accurate to their experiences. The aim of this study is to assess if cognitive interventions used as a part of occupational therapy treatment in home health care improves independence of self-feeding outcomes for older adults with dementia. The purpose of the survey used within the study is to gain knowledge on the level of assistance and the difficulties during mealtimes that the participants within the study may experience. After conducting our study, we found that the majority of our participants reported they sometimes required assistance while eating, sometimes required close supervision during meal times, sometimes spilled their food while eating. They reported they never had difficult time remembering how to use utensils. And then it was a 50-50 split between never and sometimes having difficulty swallowing their food. The majority of participants reported they sometimes worry about choking on their food during meal times. They sometimes worry about their safety during mealtimes, such as using knives and the temperature of their food. When asked how much assistance was required during mealtime, the majority of participants answered moderate. When asked what type of assistance, if any, was required during mealtime, some of the answers we got back were verbal, physical, adapted utensils, supervision, smaller bites, or food prep help. When asked what concerns, if any, do you have regarding self-feeding at mealtimes, our participants answered choking, safety, temperature, spilling food, the taste of food, swallowing, verbal assistance, and feeling embarrassed. The majority
is participants that are only. Some limitations to our study include small sample sizes, participants that are only from the Austin, Texas area, and data collected from the surveys was limited due to small options for responses. This had a negative impact on the statistical analysis completed for this study. Some delimitations of our study include only individuals between the ages of 65 and 90 who have been diagnosed with dementia and have been referred to home health OT to work specifically on ADL of self-feeding. This study focuses on cognitive interventions for individuals with dementia rather than focusing on physical or behavioral interventions. Some future studies could examine the impact of cognitive intervention on other activities of daily living, or determine if cognitive interventions would be helpful to use as a preventative measure for the progression of dementia, or evaluate the impact of caregiver education as an intervention approach for mealtime difficulties on the client's mealtime. The results of the study can help future OTs utilize intervention approaches in a holistic way to improve the occupational performance and self-feeding skills in their clients with dementia. Some future studies. This slide includes our references. Thanks so much for listening.